Costochondritis and fibromyalgia are two conditions that can cause chest pain and discomfort. Costochondritis is an inflammation of the cartilage that connects the ribs to the breastbone, while fibromyalgia is a chronic pain disorder that affects muscles and soft tissues throughout the body. While the two conditions are different, they can both cause chest pain and make it difficult to breathe. Costochondritis is typically caused by injury or strain to the chest, but it can also occur without a known cause. The pain is often described as sharp or stabbing and can be worsened by coughing or taking deep breaths. Fibromyalgia, on the other hand, is a chronic condition that causes widespread pain, fatigue, and tenderness throughout the body. Chest pain is just one of the many symptoms that people with fibromyalgia may experience. If you are experiencing chest pain or discomfort, it is important to see a doctor to determine the underlying cause. While costochondritis and fibromyalgia are not life-threatening, they can significantly impact a person's quality of life. Treatment options may include pain medication, physical therapy, and lifestyle changes to manage symptoms and improve overall health. Understanding costochondritis. Costochondritis is a condition that occurs when the cartilage that connects the ribs to the sternum becomes inflamed. This inflammation can result in chest pain that can be sharp or dull and is often mistaken for heart-related issues. Costochondritis is more common in women and people over the age of 40. It can be caused by chest trauma, repetitive strain, or infection. The pain associated with costochondritis can be exacerbated by certain movements such as deep breathing, coughing, or sneezing. The chest pain associated with costochondritis usually lasts for a few weeks but can sometimes persist for months. Treatment for costochondritis is focused on managing the pain and inflammation. This can include over-the-counter pain medication, hot or cold compresses, and physical therapy. It is important to note that costochondritis can also be a symptom of fibromyalgia, a chronic pain disorder. People with fibromyalgia may experience widespread pain, fatigue, and sleep disturbances in addition to costochondritis. If you are experiencing chest pain, it is important to consult with a healthcare provider to determine the underlying cause. Symptoms and diagnosis of costochondritis. Costochondritis is a condition that causes inflammation in the cartilage that connects your ribs to your breastbone. This inflammation can cause sharp, stabbing pain in the chest that may be mistaken for a heart attack. The most common symptom of costochondritis is chest pain that is often described as a sharp, stabbing pain. The pain can be felt on one or both sides of the chest, and it may worsen when you take a deep breath or cough. The pain may also be accompanied by tenderness in the affected area. In addition to chest pain, some people with costochondritis may experience pain in the back or abdomen. The pain may be more severe when you move your arms, and it may be relieved by rest or by applying pressure to the affected area. Diagnosing costochondritis can be tricky, as the symptoms can be similar to those of other conditions, such as fibromyalgia or non-cardiac chest pain. To diagnose costochondritis, a doctor will typically perform a physical exam and ask about your symptoms. They may also order imaging tests, such as an X-ray or MRI, to rule out other conditions. If you are experiencing chest pain, it is important to seek medical attention right away, as it could be a sign of a more serious condition, such as a heart attack. The connection between costochondritis and fibromyalgia. Costochondritis and fibromyalgia are two conditions that often coexist and share similar symptoms. Costochondritis is an inflammation of the cartilage that connects the ribs to the breastbone, causing chest pain and tenderness. Fibromyalgia is a chronic pain disorder that causes widespread pain and tenderness throughout the body. There is a strong connection between costochondritis and fibromyalgia. In fact, costochondritis is a common symptom of fibromyalgia. Research has shown that up to 70% of people with fibromyalgia also experience chest pain due to costochondritis. The exact cause of the link between these two conditions is not fully understood. However, it is thought that the widespread pain and inflammation associated with fibromyalgia can trigger the development of costochondritis. Additionally, the pain and tenderness associated with costochondritis can exacerbate the symptoms of fibromyalgia. It is important to note that not all cases of costochondritis are linked to fibromyalgia. Costochondritis can also occur as a result of physical injury, infection, or other underlying medical conditions. If you are experiencing chest pain or tenderness, it is important to seek medical attention to determine the underlying cause. Your healthcare provider may recommend imaging tests, blood tests, or other diagnostic tests to rule out other potential causes. In summary, while costochondritis and fibromyalgia are separate conditions, they often coexist and share similar symptoms. The link between these two conditions is not fully understood, but it is important to seek medical attention if you are experiencing chest pain or tenderness. Treatment options. There are several treatment options available for individuals with costochondritis and fibromyalgia. Treatment options may vary depending on the severity of the condition and the individual's specific symptoms. Medications. Anti-inflammatory drugs such as ibuprofen and naproxen can help reduce pain and inflammation associated with costochondritis and fibromyalgia. Non-steroidal anti-inflammatory drugs like diclofenac may also be prescribed by a doctor. Physical therapy. Physical therapy can help improve flexibility and range of motion in the affected area. Gentle stretching exercises can also help alleviate pain and discomfort. Acupuncture. Acupuncture is a technique that involves the insertion of thin needles into specific points on the body. Chiropractic. A chiropractor can use spinal manipulation and other techniques to help reduce pain and inflammation in the affected area. Massage. A massage therapist can use various techniques to help reduce pain and inflammation in the affected area. Exercise. Gentle stretching and low-impact exercises such as swimming and walking can be beneficial. Surgery. This option is typically reserved for cases where other treatment options have not been effective. It is important to consult with a doctor to determine the best course of treatment for your specific symptoms and condition. Coping and living with costochondritis and fibromyalgia. Living with chronic pain and fatigue can be challenging, especially when it comes to costochondritis and fibromyalgia. However, there are several ways to cope with the symptoms and improve the quality of life. One of the most important things to keep in mind is to listen to your body. It is essential to rest when needed and not push yourself too hard. At the same time, it is also important to engage in physical activity and exercise regularly. This can help manage pain and improve overall health. When experiencing a flare-up, it is important to seek medical advice and follow any prescribed treatment plan. Additionally, managing stress levels and getting enough sleep can also help reduce symptoms. Physical strain can exacerbate symptoms, so it is important to take breaks and avoid repetitive motions or heavy lifting. Using heat or ice therapy and practicing relaxation techniques such as deep breathing or meditation can also help alleviate pain and discomfort. Risk factors and complications. Costochondritis and fibromyalgia are conditions that can be caused by a variety of factors. Some people may be at a higher risk of developing these conditions than others. In this section, we will discuss some of the risk factors and complications associated with costochondritis and fibromyalgia. There are several risk factors that can increase a person's chances of developing costochondritis or fibromyalgia. 1. Injury or trauma to the chest or rib cage. 2. Overuse or repetitive movements of the chest or arms. 3. Swelling or inflammation in the chest or rib cage. 4. Infections, such as the flu or upper respiratory infections. 5. Systemic lupus erythematosus or rheumatoid arthritis. 6. Anxiety or stress. 7. Cold or viral infections. Complications. While costochondritis and fibromyalgia are not life-threatening conditions, they can cause complications that can affect a person's quality of life. These complications may include 1. Chronic pain in the chest or rib cage. 2. Difficulty breathing or shortness of breath. 3. Fatigue or exhaustion. 4. Depression or anxiety. 5. Difficulty sleeping. Conclusion. In conclusion, costochondritis and fibromyalgia are two conditions that can cause chronic pain and discomfort for those who suffer from them. While the exact causes of these conditions are not fully understood, there are treatment options available that can help manage symptoms and improve quality of life. For costochondritis, Treatment often involves pain management techniques such as nonsteroidal anti-inflammatory drugs, NSAIDs, and physical therapy. In some cases, corticosteroid injections may be used to reduce inflammation in the affected area. It is important for individuals with costochondritis to avoid activities that exacerbate symptoms and to maintain good posture to prevent further strain on the affected area. Similarly, treatment for fibromyalgia focuses on pain management and symptom relief. This may involve a combination of medication, exercise, and lifestyle changes such as stress reduction techniques and improved sleep habits. It is important for individuals with fibromyalgia to work closely with their healthcare provider to develop a personalized treatment plan that addresses their specific needs and concerns. Overall, while costochondritis and fibromyalgia can be challenging conditions to manage, there are effective treatment options available that can help individuals manage their symptoms and improve their quality of life. By working closely with their healthcare provider and making necessary lifestyle changes, individuals with these conditions can find relief and improve their overall well-being.